Hello everybody, my name is Lulu Achua. I am gonna be doing abdominal assessment skill checkout today or check off. I'm sorry I do not have an actual patient. I have delayed doing this video because I was actually waiting for to get a co-worker that I always use or any other person, but I don't have. My baby is still a year and a half old and it's not stable to be used for things like this. Okay, so I'm gonna be using the stuffed animal for my abdominal assessment. And before I start my assessment, I always like to perform the checks. Like I introduce myself to the patient. Hi, Miss Jones. My name is Lulu. I'm gonna be your nurse today, and for today we're gonna be doing your abdominal assessment. Okay. And then after that, I check her, do the two-step verification. Can you please tell me your name and date of birth? And while she said that, I cross-check with her armband. Yeah, is the right person. And I also uh, make sure I perform hand hygiene. I wash my hands and gather my supplies, which is my stethoscope for this one. And I have already explained the procedures to my patient and provide privacy by closing the curtains. And here is a door. I have closed the door. And yeah, and then I continue with asking my patient some questions. So I'm going to ask my patient some questions. Ms. Jones, any problems with your any problems with bowels? Do you have any history of constipation? Any symptoms with your GI or your GUA, urination or anything? None of that. Okay. So any incontinence problem? Um, any color or odor in your urine? um what is the clarity or what is the color of your urine like? Pale yellow? Okay. Any blood in your urine? No. Okay. So my patient, after asking history taken from my patient, and now I go with the inspection. It's always good to start by inspecting the abdomen so that we do not disrupt it if we start by palpating. So always inspect. I inspect the abdomen. um I check for the size. I check for the shape. Like, okay, abdomen is flat and round, and the umbilicus is on the right position, the normal position, which is in the center midline. And I check for things like hernia, no hernia. I also check for the skin, for the color, and yeah, the skin color is even and normal for ethnicity. I also check for any scars, any if there is any scars, any wounds. And I also at the same time I check for aortic um pulsation, check for the aortic pulse and movements, and also check for any signs, anything abnormal. So which I did not find any at the moment. Then I move on to auscultation. So for auscultation, I am gonna be doing auscultation in two types or forms. I'm gonna be auscultating for bowel sounds first, then later on I will also have to auscultate for bruits. So let me start with the auscultation of the bowel sounds, and I do it on the four quadrants. That I'm beginning from the right lower quadrant to the other side using my stethoscope. So with my stethoscope, I'm trying to get my patient. Also, I'm supposed to put my patient in a supine position where I can really get the abdomen shape and everything. So while she's on the supine position, I assume that because I try to get so that the camera can see what I'm doing. I have to auscultate. So just by listening, the right lower quadrant for 1 full minute, right upper quadrant, one full minute, then left upper quadrant, one full minute, left lower quadrant, another full minute. So at this point, I'm done with that, and I'm going to use the bell of my stethoscope to auscultate. I'm going to auscultate to get the. I'm going to auscultate the aorta, the renal. For the arteries, anyways, I'm going to auscultate the aortic right here. Aortic. On both sides of the umbilical, I get the renal. Both sides. Then I go down to the iliac and femoral. The iliac and the femoral arteries. All this I'm doing is trying to get any abnormal whooshing sound, or any sound of bruit, or any sound, any abnormal sound anyways, which I did not get any at this point. Next, I'm going to be doing percussion on the 4 quadrant stem, and I'm going to be starting with, I don't know how to place this so you can see it. So I'm going to be doing that with starting from the right lower quadrant, moving up to the left. Let me put it this way if you can see a little bit better. Oh God. No, it's not showing. Okay, put it here so I can, okay, auscultate. And after auscultation, I have to assess for tenderness, and by so doing, I have to let the patient sit up, let my patient sit be in a sitting position, and then I place one of my hand at the flank, at the back of the ribs, like so. And I strike hard with a fist, and do same for the other side. If this, I'm trying to assess any pain or any tenderness for the patient. So while I do that, I'm trying also to make sure that the patient does not feel any pain. If there is any pain, then there is an issue with that indicates an issue with the kidney. So there was no pain, and my patient is okay. Now I move straight to palpation, which I have to palpate all the 4 quadrants in a clockwise direction again, starting from the right lower quadrant, moving to the left lower quadrant. So in the palpation, let me pick the patient up like this so you can see. I'm sorry. So from the right lower quadrant, I palpate. Any pain? No. Any pain? No. Any pain? No. Any pain? No. Okay, so at this point the patient says no pain. While I'm doing that, I'm also looking at the patient's facial expression to see. Some patients might be in pain and will not really be able to express it. So I do that, and I check out the patient's facial expression to find any signs of pain during palpation. And at this point, I am done with my abdominal assessment. So I have to document my findings. And I also have to document how my patient tolerated the procedure. So every documentation is very important. I'll document the time, the date, and the procedure that was done, and whatever findings I got. If nothing, I will still indicate that everything, no abnormal findings gotten, and every other thing was okay for my patient. Thank you for your patience. Thank you for watching. Bye.